We realised a couple of years ago, with all the changes in the NHS and the changes in primary care, with the extended roles coming into general practice, that practice would no longer be fit for purpose, and we therefore looked to start a new project to expand the surgery. We've approached One Medical because of the previous experiences I had with One Medical.
Dr. Van Spelder, who we've worked with before on the Standish scheme, gave me a ring in January 2020, just before the pandemic hit, and asked if we were willing to help him solve a problem with his practice building no longer being fit for purpose. But there was a site right next door, a clinic site that wasn't fully utilised, and he knew we'd pulled schemes like that together before, and asked whether we would be interested, and clearly we were.
The way in which we've worked with One Medical so far on this project is to be very collaborative. We had such a positive interaction with them previously in developing their first portfolio, and it had all worked so well that, why wouldn't it work again? They are very almost tactile with the way in which they deal with their client, which in this instance is Aspull Surgery and WWL. And a lot of it is to do with relationship building, and the contractor forms a very big part of that when work starts on site. So being able to show people around the construction project, being able to facilitate their needs, it might be ad hoc requests, that kind of thing, and also being able to be responsive to the need for change in the design are all things that come into the mix. We believe that people have a potential to impact the design proposals of the scheme, in that this scheme is essentially a community project. That's the way we see it, that's our vision, and therefore if it's going to be that, we need to be able to listen to their requirements or make the design respond accordingly. There's been extensive communication, not just with patients, but with various different groups, people from equality reference groups to the patient participation group, which is the main group that represents the patient from the practice, over to just general consultees in terms of the local neighbours to the site. In terms of the future-proofing of the building from a One Medical aspect and from the other partners aspects as well, what we've tried to do is to try and anticipate what's coming down the track in terms of primary care, but also we've tried to create spaces that are more generic in terms of the clinical spaces to enable them to be able to meld and change to potential future requirements.
My main concern was, of course, all of the elderly people in this village. I must be the fresh air that keeps them alive longer. And it was important that we did have this facility for those people. We've always had an excellent doctor-patient relationship. In a part of the village, when you walk into the surgery room, you're not walking into a doctor, you're walking to see a friend. And that's what I think is very, very important.